Welcome back to Up Front. Wisconsin Democrats are pushing to expand health care coverage to more people. Governor Evers wants to cover an additional 82,000 low-income Wisconsin residents. He would do this by taking dollars available through the federal Affordable Care Act. Here's how it would work under Evers' plan. The governor would expand Badger Care Plus to cover people making 138% of the federal poverty level. So here's what that means. That's $17,236 a year. State Republicans counter, they already expanded coverage to people making up to 100% of the federal poverty level. That's $12,490 a year. The Republican plan did not expand up to the point that federal ACA dollars became available to the state. The governor says his plan would free up millions of dollars to be used for other things like new health care initiatives. So we're talking more about the governor's plan with Andrea Palm, Secretary of the Department of Health Services. Thank you for being here.
Thanks for having me.
Governor Evers came on the show. He said he's confident that Medicaid expansion will eventually go through. I was in touch with Robin Voss's office today. He says that this is still a non-starter for Republicans. So how do you convince Republicans this is the right thing to do?
So I think there's a number of things that are happening here that make me more optimistic the longer the governor's budget is out and available for people to look at. I think we are really trying to have a new conversation, and a governor who has put on paper what happens when you save $324.5 million and draw down $1.6 billion in new federal money, what kind of investments you can make in health care, long-term care, behavioral health, dental access, and I think that those conversations, once you see in black and white what you can do with investments, have opened up opportunities to move stakeholders, to move legislators to get to yes on a budget that expands the Medicaid program to benefit the entire state of Wisconsin.
But even if you get voters on board, because you've seen the most recent Marquette Law School poll, 70% of people asked said that the state should accept federal funds to expand Medicaid coverage. But even so, that doesn't necessarily mean that Republicans will go for it.
I'm hoping that they will listen to their local constituents, and not just their voters, but local counties, local electeds, the providers in their communities, others who understand and can see how, when that money goes back to local communities, that they benefit, that the state benefits, that the economy benefits in ways that allow us to get to yes.
And I understand that some of that money will be used for behavioral health. You mentioned that, as well as the opioid crisis. Could you give us any specifics?
Sure. So I think one of the things that we think is really important about these investments is starting to fill some of the gaps in access. Expanding the coverage to those folks is a critical piece of this, but then driving those investments to get at some of the edges that are starting to fray in the system are really important things to do. And doubling down on the work that the legislature and the former administration did on opioids and substance abuse disorders is something that we think is a really important thing to do. And so we improve reimbursement rates to providers in the behavioral health space, including psychiatrists. We think people being able to access treatment is part of how we deal with this crisis. We use some money to create what we call a hub and spoke model that would allow 2 rural and 1 urban communities to pilot this particular model that wraps behavioral health treatment into the healthcare system in a more integrated way.
I'm hearing from Republicans that one of the arguments is that taking money from the federal government means that they could stop that funding and then Wisconsin taxpayers would be on the hook. What's your response to that?
I spent the 20 years before I came here in D.C., and particularly the last 10 years, since the enactment of the Affordable Care Act, there's been a lot of talk about rolling it back, about repealing it, about taking it to court. And at every juncture, the Affordable Care Act has stood. It is the law of the land. 37 other states have expanded access to Medicaid. 75 million people in this country rely on Medicaid for their affordable, high-quality coverage. I do not see a world in which the United States Congress picks a fight with 75 million Americans. And so I think that it is in some ways an easy excuse for why we shouldn't do this in the state of Wisconsin.
Do you think it's an ideological battle or what's going on here?
I think that there are still people who anything associated with the Affordable Care Act is lumped in with how they feel about Obamacare more broadly. And so I think that there is some of this conversation that is about being frozen in time about Obamacare.
Let's switch gears a little bit. There's a measles outbreak happening right now. Last I saw, there are 695 people infected with measles, the highest rate since the year 2000.
Yep.
How has Wisconsin avoided this so far?
Yep. I just want to say I really appreciate you asking this question, because raising awareness about the opportunity that we have to protect our citizens is really important public health information. It is a highly contagious disease. 9 in 10 people who are not immune, either through vaccination or otherwise immune, will get the disease if they're in contact with it. And so it's a plane ride away. It's a kid going to summer camp and coming home who's been exposed. There are lots of ways where if you live in a community that does not have a high vaccination rate, you are much more at risk for contracting the disease. So I think we are very focused at the Department of Health Services with our county and local public health partners to chase suspected cases, to make sure if we get one here that we are on it, and that we are able to track to people that they've been in contact with, so we can get vaccinations, so that we can get antivirals, so that we can get to a place where we are stopping transmission.
Is there a high vaccination rate here in Wisconsin?
So our statewide average of 2-year-olds, which is your first dose, is about 89%, but there are some counties that are a little higher, some counties that are lower.
So would you say that's the reason why Wisconsin has avoided this so far?
Well, what we know about trying to prevent spread is that you need a community rate of about 95%. So we absolutely have some work to do to truly protect our communities, and it is why I appreciate the question, because people who are not vaccinated, they should check their kids' records, they should get them up to date if they're not vaccinated, and adults should do the same. The way we protect our communities is through vaccination, and we need to be concerned about folks who are sick, who are immunocompromised, and kids who are more susceptible to the negative consequences of infectious diseases like this, and vaccination is the way to protect them.
Thank you.
Thank you.
President Trump rallied Republicans in Green Bay last night.
And there's no place I'd rather be than right here in America's heartland, right?
His campaign says his rally at the Resch Center was his 18th in Wisconsin since 2015. Democratic candidates are visiting Wisconsin too. New Jersey Senator Cory Booker attended a gun violence event in Milwaukee in his first trip to Wisconsin as a presidential candidate. Booker said Wisconsin is essential to Democrats' hopes of winning back the White House. Our editorial partner, WisPolitics.com, has the story of both the president and Booker's visits on their election blog at WisPolitics.com. Next on Up Front, we'll go to the park, a state park, to see how self-funding is working and why a little more money could be coming.